Okay, it sounds like it, but further clarify your thoughts on vegetable oils, seed oils. It sounds like you're against them.
I'm against them.
How do you think about that whole piece, that conventional wisdom, that consuming them is good because we're lowering LDL?
Well, LDL is well, there's nothing wrong with LDL. It's good stuff. I mean, LDL. I mean, you suddenly jumped onto the high cholesterol causes. A high fat diet causes high cholesterol causes heart disease, which we know is a load of tosh. High cholesterol, and LDL do not drive heart disease. There are, heart disease is driven by sugar, high blood pressure, toxins, inflammation, and so on, not by cholesterol. In fact, I like to see people with a high LDL because LDL is just a carrier molecule. It's just the molecule that carries fat around the body. And LDL, when you're in ketosis, you need LDL to carry fat from your fat stores to the liver where it can be converted into ketones. So very often when people start on a carnivore diet or start on a ketogenic diet, you see their total cholesterol going up. Fantastic. Their LDL going up. Fantastic. HDL going up. Fantastic. Yes, that's totally desirable. They are simply the carrier molecules. And we are all deficient in cholesterol, or cholesterol deficient is very common. In fact, I think it was the Philadelphia study, which looked at total cholesterol and mortality. And for every 1% fall in cholesterol increases your mortality by 1%. I can show you a plethora of studies that show you that the higher your cholesterol is, the longer you live. Now, the cholesterol story has been hijacked by big food and big pharma because it suits their books. Atorvastatin, which is the most used statin, cholesterol lowering agent, is worth $1 trillion a year. Now, I can't get my head around these huge figures, but a trillion is a million billion, which is a million dollars. It's a lot of dosh. And you can get a lot of propaganda done with that sort of money. And there's barely a scrap of evidence that shows statins are effective. In fact, I can show you some studies that tell the absolute opposite of that.
Well, it's important we went there because, again, conventional wisdom, if you have high cholesterol, consume these vegetable oils. They're heart healthy. They're going to help you lower your LDL and you'll be better off, supposedly.
You're using the wrong words. It's not conventional wisdom. It's modern propaganda. That's the word we should be using. And I'm delighted to see that a British cardiologist called Dr. Aseem Malhotra, who's written a super book, A Statin-Free Life, essentially detailing what I've just been saying, is now JF Kennedy's right-hand man on the Make America Healthy Again scheme. And so at last, perhaps, we can start to see things turning around and get big pharma's grippers off the medical profession. The medical profession has been completely brainwashed by big pharma. We just don't have enough good doctors with independent minds who are speaking the truth.
Well, we've connected by email and it sounds like he'll be coming on the show, so I'm a big fan of his work.
Fantastic.
If you enjoyed that clip, you're going to want to head over here and catch a full episode. I'll see you over there.
The upper fermenting gut is a major problem. It goes almost unrecognized by the conventional doctors. We have to get rid of the upper fermenting gut. And yes, there's a two-pronged approach. Yes, we starve them out with a low-carb ketogenic diet. And secondly,